So opening this up to questions and answers, do we have the ability to take questions for people who are remote as well?
Yes.
Oh, great. Okay. Okay.
Calling from Saskatoon.
Yes. Okay. So from Saskatoon, you have a question?
Is there a limit to the number of expansion panels you can put into the pants?
I would only recommend putting in 2 expansion panels. So that would be 2 on each side of the pants. If a patient needs more than that, then they would be better served by the lymphopod. The reason being is that the chambers are the part that inflate, and the panels are not. So the panels will be part of the garment, part of the circumference, but the patient won't be getting treatment over those areas. So particularly if they have fibrosis or spot swelling on the lateral sides of their legs, they would be better served with a pod if they are not able to fit into the pants with 2 expanders.
So just for the remote attendees that may not hear the question, we're just going to repeat the question each time.
Thank
So
you,
that
Tracy.
question was whether or not there was a limit to the number of expanders that you could put in with the garments.
Thank you. Great. So do we have other questions?
Again from Saskatoon.
Yes.
I'm wondering what the purpose of the chamber in the axilla is. It to prevent flow into the axilla? Because when we do manual lymph drainage, if there's lymph node dissections on that side, we don't want to move fluid into that area.
So the question concerns the chamber in the comfy sleeve that provides specific compression into the axilla. And the concern was not wanting to direct fluid into the axilla area where there are possibly fewer lymph nodes and compromised circulation. So the purpose for that is to actually help in directing the fluid out of the axilla. So if you think of the comfy arm sleeve as following the principles of manual lymphatic drainage, you're starting at the tip of the fingers and moving segmentally up the arm, and you're going circumferentially around the shoulder and the axilla, and you're clearing the axilla and moving the fluid down the lateral side of the body towards the deep abdominal collectors and the inguinal lymph nodes. So the purpose of that chamber is not per se to overwhelm that area, but rather to clear it and help the movement of the fluid out of that area. And I think that's very important because you're also working with the arm. So you are getting quite a movement of fluid out of the arm. And it's very important that it continue down to the other lymph nodes that are intact. And Tracy, did you have a comment on that?
I'm just going to comment for some of the newly trained therapists. Depending on your school of training, I think that's where some of the confusion comes or concern comes, because depending on the training, they may or may not address that clearance of the affected axilla. So for example, if you go to some courses that are Castley Smith based, that is a sequence that they do, whereas some other instructors may avoid that area. But the premise is to clear the functioning lymphatics in that area. We're still not directing the fluid through those axillary channels to that area. We're still redirecting. We're just pumping the lymph nodes in that region to facilitate any emptying that the remaining lymph nodes can do to clear that region. So again, it's redirecting still. We're not pushing fluid into that area. We're just clearing that. And you will see that with other schools, that's standard with their MLD practice.
That's a very good point, Tracy. The other thought that I had is that for many of our patients who have axillary node dissections, they might have heavy scarring in the axilla. So another benefit of having that chamber in the axilla is that it provides an anti-fibrotic massage for the surgical fibrosis. And I will commonly use swell spots or chip foam garments that help to compress the axilla and work on that scar tissue and softening the scar tissue. Because my clinical observation is that if I can create a softening of the tissues that are fibrotic, and by the way, when we speak of fibrosis, and this is a whole other lecture, don't get me started, there's lymphostatic fibrosis, which is the soft, fatty fibrosis that you see in an extremity as a result of chronic congestion. But there's also a harder fibrosis that occurs as the result of surgery or radiation or even a cellulitis infection. And those harder types of fibrosis can create obstructions themselves in the lymphatic system. If you have a scar that is acting basically as a barricade, it may be very difficult for fluid to move in that pathway and has to be directed around it. But if you can actually soften that scar, you can create pathways through the formerly hardened tissue and allow better circulation.
And certainly in my practice, that's an extensive amount of treatment that we do with, for example, breast cancer patients that have extensive surgical fibrosis, but also radiation fibrosis. And radiation fibrosis physiologically is changed from the radiation. It's much more inflammatory in nature. It will contract and continue to scar over time, years after that radiation is completed, and it can create significant blockage. And a lot of times just working on that fibrosis can actually have significant impact on the lymphedema and how intensive you need to be with further lymphedema management. As I mentioned earlier, with some of those cases that have extensive fibrosis, we'll do a lot of soft tissue work, open up some channels, and then either proceed with manual lymphatic drainage or the pump to get better clearance through that area.
That's great. Are there other questions?
Yeah, I have a question here in Kelsey Trail. In our package, we have in Melbourne, we have a comfy sleeve and a bilateral upper extremity sleeve, but we have no lower extremity sleeve. And I'm not sure whether others across the province have received a variety, and this is just an error that was made, and what we should do about it.
So the question concerned the handouts, and there was received information on the comfy arm sleeve and the bilateral jacket, but not on the lower extremity garments. And so we will correct that and make sure that everyone has access to information about all of the pump garment appliances.
Sorry, no, that's a misunderstanding. I don't know the information. We didn't receive any lower extremity garments at all with our new.
Oh, okay, so I misunderstood the question. So you physically do not have any of the actual appliances in your clinic, is that the question?
That's correct.
Okay.
So that is a mistake. You should have a package that includes those garments, and so that's something that we'd have to review with the Ministry of Health, who is responsible for distribution of those garments. So that's definitely something we will address after this presentation today.
Thank you for that. Good. Other questions? I'm sorry, was there another question?
Yeah, we're in Kelsey Trail again. The other question I had, and Trace, it's probably more for you or for the ministry. Is there a certain criteria that we have to have our clients meet before they would be eligible to have their own pump at home? And is there a amount of time they can have it for, et cetera?
There is a process, and
So repeat the question.
Oh, I'm sorry. The question was, is there a process for patients to obtain a home pump? And there is a detailed process. It is outlined in the policy. I'm not sure if Sale's going to go through that completely or just refer to where that policy is. But essentially, they have to go through a trial period. So we would, the CLT therapist would put them through a trial and deem that objectively that pump is effective for their long-term lymphedema management plan. And there needs to be a prescription from the physician, so oftentimes we will have to write a letter outlining this patient does require this following that trial period. The physician submits that paperwork. We have to take measurements for the actual garment itself, and we submit that to our local vendor. Our local vendor is the Pink Tree in Saskatoon, and I did bring along the prices for a home pump, so I'm just going to find that sheet here. SAIL has a policy, they do provide a $4,000 grant for primary cases of lymphedema. So in order to get that grant, this is the process you have to follow: that home trial period, a letter from the physician, and filling out the paperwork to submit for that grant. If it's a secondary patient, there isn't a grant in place for those patients. During the lymphedema working group, the initial working group, we did make that recommendation that pump is not really used for either primary or secondary, but both, and it's depending on the stage and the type of lymphedema and how it's used within that full management process. So I believe what's going to happen is they're going to roll out the pumps in the regions and utilize the pump over the next year, and then they're going to reevaluate that. There was a substantial amount of money that was initially doled out for the training of the therapist, as well as for coverage of garments. So through the lymphedema working group, initially, before that, patients were covered for 2 day garments every 6 months. We now have full coverage of 2 garments every 6 months, coverage for a night garment every 2 years, coverage for full compression bandaging, and coverage for swell spots. So I think with the initial financial investment, there's also some patient education initiatives that were also financed. So we've just completed shooting a video for a patient resource that Carla developed. It's very comprehensive. It's for breast cancer patients. So each breast cancer patient is going to receive this comprehensive education package at the point of pre-admission to surgery. When they go for their workup prior to surgery, they'll receive this. There's a video that goes with that education resource that we just shot, and it basically goes through all the exercises post-surgery, all the instructions around that. It also has a big section on lymphedema and full education on the full management of lymphedema. It also has patient testimonials, and we just saw the first cut of it, and it's going to be a great resource. So that's rolling out. The editing will finish in March, and then after that, we should see some distribution of that resource. So in terms of the pump grant, I think they were getting all these measures in place, and after a year of the pump being in the regions, they're going to reevaluate the use and start looking at that additional funding possibly for secondary patients. In terms of our vendor, if a patient who is, let's say, secondary is wanting to purchase a home pump, again, we go through the Pink Tree in Saskatoon. Just give me a second to find the handout here. I'm just going to get you to hold this for a second.
Sure. And while she's looking, I thought of another comment that I want to just reemphasize. In my practice, I use a lot of manual lymph drainage in the clinic, but after a patient is discharged to their home treatment and they have their compression garments and they may or may not have a pump, we're encouraging patients to continue manual lymphatic drainage, and patients may use the pump and they may also do manual lymphatic drainage in specific areas that is more fine-tuned than the pump. And additionally, we may recommend that patients follow up with private manual lymphatic drainage therapists in the community. Often they will act as our eyes and ears in terms of monitoring patients and looking at their levels of edema, and if things start to change, they will encourage a patient to refer back to the clinic. So I want to just emphasize again that we are using the pump as well as manual lymph drainage. We use both with each patient, and that one is not a substitute for the other.
I'm just going to add to that. I bring my patients back to review and reassess, and they'll come in addition for manual lymphatic therapy treatments if they have a home pump or they're using pump as well at the clinic, to constantly reassess the effectiveness of that. And to use all those tools. It's no different than a garment. You put a patient in a garment, you don't just leave them in that garment, fit them, and don't see them again for 6 months. It happens, but that garment needs to be reassessed for proper fit, because there's no difference. If you have a improper garment, you're going to see congestion in the hand, and if that's left over time, we're going to start to see fibrotic changes and that lymphedema worsening, or the same in terms of the proximal area if that garment's not fitting. So that constantly needs to be reassessed, just like the use of the pump. So getting back to that previous question of the home pump process, if it's a secondary patient, they can be referred to the Pink Tree. Now, usually we do the measures, or sometimes what we'll do is we'll do the measures and give it to the patient and they follow through with the process. Or sometimes, depending on the patient, we assist with that. But basically, we have quotes for all the different pieces here. The quotes are good for a month. So every time you have a patient, you have to get a new quote, because this will change. So for the LymphoPress Optimum pump, the charge is $4,900. The LymphoPress Pod is $3,100. LymphoPress Pants, $2,175. The expanders per pair are $280. The hose bundles are $220. The LymphoPress Jacket Bilateral is $2,020. LymphoPress Jacket Unilateral is $1,300. And so you're looking at, we just recently ordered a pump for a breast cancer patient with a comfy sleeve, and it came to about $6,000. There is GST and shipping on that. So that's roughly the amount that has been charged. And we actually got the Pink Tree to bring their prices down. 2 years ago, they charged $10,500 for that. So patients were having difficulty managing that. And for cancer patients, there are some financial assistance programs that we have utilized, Forever Friends of Hope. We've been able to get some cost coverage for a variety of lymphedema before the night garments were in place. We would use them for that, but they do cover the pumps. Hope Cancer Center, they have also helped. And for primary patients or other types of, sorry, not primary patients, other types of secondary patients that don't qualify for the grant, so bariatric, some of the combined venous lymphedema cases, trauma, we have utilized the Kinsman Foundation for financial assistance. But it's quite a process. There's lots of paperwork to fill out. They have to be approved. And so hopefully we'll see some grant options for those patients as well in the future.
That's great. So while we've been talking, I'm curious if anyone, either live here or remotely, has thought of any additional questions?
Yes, I got a question.
Okay. Is this a question from Prince Albert?
Yes, I got a question from Prince Albert here. We've turned on the pump and we've set it up to demo, and we're unable to select between the different treatment modes. It is staying on the pre-therapy and sequential. Is that locked into place until we have it hooked up to the computer, or is this something that should be able to be selected right now?
You should be able to select it right now. I'm sorry, the question which came from Prince Albert was regarding the programming of the pump. And that is being able to unlock the computer within the device and to program it. So I'm going to review that because we went through that fairly quickly. So I'm going to go back over to the devices. This is very important because this is really the key to how you customize your programs for your patients. So the first step is to turn the device on. So to unlock the feature that locks this for the patient so that the therapist or clinician can program this, what you're going to do is go to the lower left-hand side of the unit, and there are some arrows. There's the word select with an up and a down arrow on either side of it. You want to press those two arrows simultaneously, and you will hear a slight beep. So keep holding them till you hear the beep. Are you doing this live as we're doing this? Did you hear the beep?
Yes.
Great. Okay. So now you're going to see on the screen, it says password. So
Yes.
the password that you're going to use is you're going over to where it says pressure, and there's a plus and a minus sign. You're going to press the button that has the minus sign 4 times. And after you do that, if this is the first time that the machine is being used, you may see a little message that says, would you like to go into zone mode? And the answer for that would be yes, so you would press start, because the start button is how you save or enter or indicate yes.
Got it.
Okay, so now you should see 4 groups of numbers across the screen.
You.
Okay, and at that point, you can adjust the pressure of these 4 zones, and you can also use the up and down arrows in the lower left-hand corner to scroll through the programs. So go ahead and just press one of those, say the down arrow, and you'll see that the light in the lower left-hand corner is going to illuminate a different mode of operation so that you can choose either peristaltic or sequential or the pre-therapy plus the peristaltic or pre-therapy plus sequential.
Okay.
So once you've selected the program, and once you have selected the amount of compression, you will press the start button, which will save your program and relock the device.
Excellent.
Great. Okay. That was a great question. I was happy to review that. So other questions? I think that there was another question that was coming in at the same time as Prince Albert. Was there another remote question?
Yes, from Saskatoon.
Yes, Saskatoon, what is your question?
I just have a couple of comments. I'm Jan Block. I work with the Fine for a while here in Saskatoon. And sometimes for funding for pumps for home use, insurance companies, that people have third-party insurance through their work is an option, and that has been helpful for some patients who otherwise don't qualify. They don't have primary. The other question I have is, one, you reassessing these clients, do you think there's a maximum amount of time that, and obviously it will be individualized to some patients, but what would you say would be the maximum before you want to have a patient coming back to see you again, to see how pump is going in a rural area, back to the CBT trained therapist?
Okay, so there are 2 questions, and I think Tracy should probably take the first question. And do you mind if I just start with the second question?
Sure.
So the second question was regarding home use. And if you have a patient set up at home, how long should you allow before they come back into the clinic and are reevaluated? And I think the answer to that is dependent upon the patient. If a patient is very, very remote and it's a hardship for them to come in, sometimes I will do troubleshooting over the telephone, but I like to see people in person. And if it's possible, I sometimes have patients that come to my clinic from far away. They'll come from other parts of the United States. And what we will do in that case is if they're doing an intensive treatment, I may have them just stay in Santa Cruz for a few weeks, and we do an intensive treatment, and that way I'm evaluating them and reevaluating them every day. And if we're doing a pneumatic compression program, I want to see how they respond to it a number of times before I send them off thousands of miles home. So in an ideal situation, you've got a patient that is close by and they can come in within a day or a few days or a week after they've started using it at home so that you can work out any bugs. I'll have patients actually bring in their device because, as Tracy said, we're constantly changing, evaluating, depending on how garments are working, and the pump is no different. I will adjust compression, time, even programming, depending upon how a patient reduces or how their fibrosis changes. So rather than give you a real definitive answer, I'm just giving you a lot of scenarios, because you'll have to really use your clinical judgment how a patient is responding and how soon they're going to need to have adjustment, and whether they need very immediate reassessment, or whether it's going to be more gradual and it will take them longer to change and need to be reevaluated. And I don't know if you want to add to that, Tracy?
Yeah, I agree completely. It's very individualized, and it's based on sort of constant reassessment. I think compliancy is another factor that comes into it, as I said earlier, and that study sort of talked a little bit about. You'll send them home with complete instructions, and they may come back with setting that pressure differently or a different frequency. And so you want to constantly reevaluate that and make sure that they're following something that's safe and effective for them. It's no different than your full CDT lifelong education management toolbox with these patients. Depending on the patient, every single patient's individualized. We have sort of a base protocol that we can follow with CDT, but every patient's going to have a different program, and it's going to be based on how they tolerate and how their system functions. And sometimes that takes quite a bit of time to find what their triggers are, what the balance is between activity, drainage, pump, and you'll figure that out in time. And once you see that you have a program that's maintaining their edema, it's effective, they're stable, we're not seeing lots of flare-ups and periods of infection, then you can go more into that maintenance phase and just sort of reassess, but you'll have a better sense of how often you're going to need to do that. I'm not sure if that was a question, Janice, that first remark you made. I think it was more just pointing out, which is a great point, that some insurance companies also provide coverage under their plans for compression pumps. So if there is a secondary patient that is looking for a home pump, do advise them to check into their insurance plan.
Great. Do we have other questions?
Hello, Minister. We have a question.
Yes.
Basically, we want to know how to clean in between each client. Do Excel wipes work, or what do you use?
So the question has to do with cleaning pumps in between each client. And at our clinic, we basically use a Wexide-based wipe, which is a very, very strong antiseptic wipe that we wipe down all the interior surfaces and the zippers of the pump. And we wipe to the point where we can actually see like some glistening liquid on the appliance itself. At home, patients don't necessarily need to do much at all in terms of cleaning or maintenance, although if a patient has a wound, they can use a cloth and soap and water, and that can clean an appliance. But Tracy, do you want to?
We follow the same procedure.
Yeah,
essentially.
yeah, and that's why having stockinette liner is actually even a little more sanitary than using the patient's garments. But it depends upon the individual patient and what you're treating. But that's a very good question. Other questions? I would encourage all of you to actually demonstrate the pump on yourself. I would try every single one of the appliances. I would try every single one of the programs. When we were developing the Comfy Sleeve and the Pod, I got in them a number of times just to feel what a patient's going to feel. Now, if you do not have edema, you will not want to have a higher level of compression. It's going to be less comfortable. But patients who have higher body mass or higher levels of edema may really need more compression. So as a patient reduces, you may find that you're reducing the amount of compression. And for people who are unaffected, I would start with the lowest amount. But it's actually a very pleasant and pleasurable experience. And I think that in order to understand what you're offering your patients, it's good to go through that experience yourself. Would you agree, Tracy?
That's a great point.
Yeah, and it's amazing how the pod will actually inflate to fit. I mean, for a petite person in a large appliance, it will actually give a really good treatment.
I just have a couple comments. So in your handouts, there was also a handout for the lymphedema pump, the IPC treatment plan, that was actually drafted by Janice in Saskatoon, and just a few little revisions on our end. For the new lymphedema therapists, we are working on standardizing some documentation and assessment forms, as well as some education forms. And that form that was sent out is the draft copy. So we are going to be meeting shortly here to finalize some of that documentation, and there will be a package that goes out. And in terms of the pump package, you will see that treatment plan as well as the progress sheet. We will include the information on the pump home process, so we will have a copy of the policy. We will also have some patient education forms around home use. And as well, we're going to put in a copy of the quotes and the dealer information. But again, that needs to be reviewed every time you put a request in with the company for a new quote. The other thing I want to mention is for those of you that are familiar with Pathways magazine, so this is the Canada's Lymphedema magazine, the Canadian Lymphedema Framework. There's actually an article that came out this month on the use of pump in lymphedema management, so it's very timely. So I encourage you, if you have this publication, to take a read through that. And then I also just wanted to bring up a couple courses that are coming up right away here. So we have, first of all, the Breast Cancer Rehab Symposium, which is taking place in Saskatoon, February 27th and 28th. This is going to be a great conference. We have some big names in the cancer rehab world coming down to Saskatchewan. And for those that do treat cancer-related lymphedema, this will help put that big picture together. Lymphedema is part of the treatment in cancer rehab, but there is extensive other rehabilitation needs that go with that, and they go hand in hand. If you're not properly treating that radiation fibrosis, if you're either not getting that mobilized or you're causing inflammatory response by too aggressive techniques, you're going to cause more issues with lymphedema. So we encourage you to take a look and sign up. The early bird registration is coming up right away. And then also we have the Lymphedema Symposium through the Lymphedema Association of Saskatchewan coming up on May 9th and 10th. Our keynote speaker for this is Dr. Towers. She's from Montreal. She's the only physician in Canada that specializes in lymphedema. So it is a great opportunity to have her come to Saskatchewan and share her knowledge and expertise. We will be doing some additional presentations with wound care. And I'm going to be doing a presentation on aquatic lymphatic therapy, which Karen referred to earlier. And for the CLT therapist, we have confirmation that we can bring Dorit Tidar to bring the certification course here to Saskatchewan in the next year. So just keep those in mind, and that's going to just provide more education and help build on lymphedema management in Saskatchewan. And as we said, there's a lot of changes with these new therapists and pumps. They're out there, so you need to understand how to use them, and you need to understand how to use them safely. So we hope that you found this useful today.
And for those of you who are watching this remotely, we are videotaping this, and there's going to be some additional videography of demos of the appliances and the device. So that's a wonderful thing because it will allow you to review this. I think it's important to hear information more than one time, and especially if it's brand new information, if it's a new model of treatment to you, I would encourage you just to go back to your resources, to review them, to try it out, and then trial it with your patients, and then review again, because I'm always learning new things. I'm always rereading research and articles and picking up new things. So I encourage you to take advantage of the wonderful resources that are being provided for you here.